we are going to look at the vegetations. So the vegetations in case of various types, of the endocarditis. So the questions here are: the first question, in case of RST, where is the site of vegetations? The second question is, in case of the infective endocarditis, the same, that is, where is the site? The third question will be, in case of the Liebman, the Liebman-Sachs endocarditis, where is the site? So in this video, we will find out the answers to all these questions and learn a lot more in this subject. So first, we will start off with the RST. RST, as we know, is a rheumatic heart disease, and here what is the cause? So the cause, if you see, it can be the rheumatic heart disease. And next, when we look at the vegetations, it is small, it is warty, as well as it is firm and friable. Now looking at the site, this is important. The site is, it is along the line of closure, along the line of closure. So it is along the line of closure. So then we look at the sterile. We look at if it is sterile or infective. So if you look at sterile or infective, it is nothing but it is sterile. And what about the embolization? So in terms of the embolization, it is not common, it is uncommon. So then after RHD, we move on to the infective endocarditis. The infective endocarditis. So under the infective endocarditis, the etiology we know it is for, it happens in case of the infective endocarditis. Then the vegetations, if you see, it is large. It is large, it is bulky, it is friable, as well as it is destructive. So these are the features. Now if you look at the site of the infective endocarditis, the site, it includes the cusps of the valve, and the mural endocardium. So it includes the cusp of the valve and the mural endocardium. So is it sterile or non-sterile? The answer is it is non-sterile. And the embolization is that it is very common. It is common. Next, we'll move on to our next, the non-bacterial thrombotic. The non-bacterial thrombotic. The non-bacterial thrombotic or the marantic endocarditis. Non-bacterial thrombotic or the marantic endocarditis. So what is the etiology of this? So the etiology of this is nothing but it includes the malignancy, that is a M3 AML, a pancreatic carcinoma. Next, also the deep vein thrombosis and the Trousseau disease, the Trousseau syndrome. Then if we look at the conditions, it includes the vegetations. So the vegetations, it includes, they are small, they are multiple, and they are non-destructive. So where are they present? So the site, if you see, they are at the line of closure. Line of the closure. So is it sterile or non-sterile? The answer is it is sterile. So previously what we saw sterile was the rheumatic heart disease. Here also it is sterile. Then what about the embolization? So embolization, if you see, it is common. It is common. Lastly, we will look at the Libman. The Libman Sachs. The Libman Sachs endocarditis. So under the Libman Sachs endocarditis, we need to know the cause can be the SLE, that is the systemic lupus erythematosus. And what about the size? The vegetations. The vegetations, if you see, they are small to medium size. They are small to the medium size. They are flat. They are flat and they can be verrucous. So where are they present? The site, if you see, the site is it is either or both sides. It is on either or the both sides of valve. Either or both sides of the valve leaflets. So is it sterile or non-sterile? The answer is it is sterile. And is it common or uncommon? Is it common or uncommon? The answer is it is uncommon. So here common or uncommon, we are referring to the embolization. So now we'll be answering our questions. So the first question we asked was, in terms of the rheumatic heart disease, where is the site? So the site is of the vegetation is it is along the line of closure. The second question we asked was, what is the site in case of the infective endocarditis? So here the site is it is on the cusps of the valves as well as the mural endocardium. The next question is, in case of the Liebman-Sachs endocarditis. So in case of the Liebman-Sachs endocarditis, what is the site? The site is it is either or on both sides. It can also be on both sides of the valve leaflets. So now we'll move on to our bonus questions. So you can answer these bonus questions in the comments. So the first question we would like to ask is, in case of the RST, how are the vegetations? Describe the vegetations in case of the RST. The second question we want to ask is, in case of the infective endocarditis. In case of the infective endocarditis, how is the vegetation? And also, I will write a note on the sterility and embolization of the same. Embolization and the sterility. So how is it for the infective endocarditis? The last question will be, in terms of the non-bacterial thrombotic, non-bacterial thrombotic or the marantic endocarditis. So in such case, where is the site of vegetation? You can answer these questions in the comments.